prevention is priceless. From one cancer cell to a tumor is about 8 to 10 years. So that means we have so much opportunity to prevent cancer.
Welcome to the Beljanski Cancer Talk Show, where we uncover stories and insights that truly change lives. Today, we're joined by a remarkable guest, Dr. Lee Aaron Keneally, a trailblazer in integrative medicine who spent over 37 years helping people heal from the inside out. As the medical director and founder of Center for New Medicine and Cancer Center for Healing, the largest integrative clinic in the U.S., she's dedicated to addressing the root causes of disease and empowering people to take back their health. She's also the author of The Cancer Revolution and host of the Cancer Conversation web series, inspiring countless lives around the globe. You're in for something truly impactful today. Let's dive in.
Hello, Dr. Connelly. Thank you for joining us on the Beljanski Cancer Talk Show. I'm delighted to have you, an honor to have you, because you are really one of the top well-known cancer doctor in the country, and it's going to be a treat for everybody who is listening today. You have a really interesting profile because you started your career as a medical doctor working in partnership with a nutritionist. And that's very unique because nutrition is one of the things that are not spoken too much about in medical school. So what led you to this path of working from the beginning with a nutritionist and understanding the importance of food in our overall health?
Right. Well, a lot of different paths in my journey have kind of brought me to that, but it really started early on. First of all, I'm number three of six children, and my mother really would read all the books of Adele Davis. I don't know if you're familiar with Adele Davis, but she was a very famous nutritionist a long time ago. And she's written many books on having healthy children, healthy families, etc. And so growing up, I usually ate at home and my mother cooked all the meals. We had raw milk, we ate liver, we ate sauerkraut, we ate foods that nourish and strengthen our bodies. And so we rarely went out. My mother never used a jar of baby food. She made all of her own baby food for all six of us. She nursed us all for a year. So that's how I grew up. I mean, I never grew up on going to a fast food place or anything like that. And so then when I was a teenager, my parents received a letter that my mother had taken DES when she was pregnant with me, and that I needed to go to the local cancer institute, which happened to be MD Anderson in Houston, Texas. And because they said all those offspring, male and female offspring, had increased risk of cancer, hormone problems, infertility, anatomical problems. And so I started going to MD Anderson with a team of doctors examining me, biopsies, all kinds of things. And so they encouraged me to continue getting routine exams, etc. And so then
Excuse me, at the time you were feeling well. There was no symptoms,
there was
you
no
were,
symptoms,
yeah.
but I did have dysplasia, okay? And so dysplasia is so you have normal cells, you have dysplasia, and then you have cancer. So I had a pre-cancer condition. And so then I was really good in biology, and I said, "What can I do in biology and talk to people?" And so sure enough, I went to medical school and I went to medical school, and because I did not have two regular menstrual cycles, I found a doctor. This was many years ago, and they immediately put you on birth control pills for really any abnormality a woman is experiencing, but especially irregular menstrual cycles. So I started taking the birth control pill when I was in medical school, which it completely changed me physically. And so I was like, no, this is not a good way to go. So then I get out of medical school. I go to Harbor UCLA for training. And then I start working in emergency room, urgent care. And then I met a doctor who was a pathologist and internist from Russia. And he started teaching me about things that I like, whoa, we didn't learn this in medical school. And he also told me about how you need to teach patients how to eat. And I was like, wow, this is like all novel, even though it resonated with me. And so then I started my practice 39 years ago with a registered dietitian and myself and doing comprehensive lab testing. And really, the people that came to me were they wanted to lose weight. And because that's a great way to get patients. And then so that path of my irregular menstrual cycles, the DES, my upbringing, and this doctor kind of all like said, you've got to teach people how to live. And sure enough, from long time ago, I had people do food journals. I had people like I asked patients how their sleep, the water, the eating, food journals, all these things. And then that led to everything that I'm doing today.
And now your Center for New Medicine and Cancer Center and Healing is the largest and most advanced integrative functional medicine clinic in the US. So how
Yes.
did you get there?
It started as a clinic just treating patients for everything, but really optimizing them and trying to de-diagnose their medical conditions. So we started out seeing everything from weight loss and then hormones and then metabolic disorders and autoimmune disorders and everything. And then I was working with an oncologist here and I referred all my cancer patients to this oncologist and he was great and wonderful. And I said, how would you like to be interested in doing an integrative oncology program? So he said, yes. I was like, wow. So we went down to Mexico and visited Oasis of Hope with Dr. Contreras. And he said, and Dr. Contreras is a cancer surgeon. So he was very impressed with what Dr. Contreras was doing. And Dr. Contreras had always wanted to open up a cancer center in the United States, but he didn't really have anyone that he wanted to partner with. So he partnered with me and this oncologist and myself. And we started that probably 20 years ago. And then Oasis of Hope, when people could come to Irvine, they didn't want to go to Mexico. So we decided to amicably part ways. Dr. Fong developed an autoimmune condition. So then it was just me. And so then I developed an integrative oncology program here, which we do today, which is constantly evolving because there's all kinds of new information. So it marries the best of conventional with all the integrative protocols that are out there, whether it be vitamin C or different IVs, whether it's assessing people's voltage, their nutrients, their toxin analysis, heavy metals, et cetera, et cetera, et cetera. And so so the Center for New Medicine is the Human Optimization and Chronic Diseases, and the Cancer Center for Healing are patients who've been diagnosed with cancer and they want to marry an integrative approach, or they have failed, conventional medicine has failed them.
Mhm.
And so I would love everyone to be interested in prevention and early detection because as chronic disease is in the news all the time now, and our health system every day is becoming more broken and more expensive. If we would focus on prevention and early detection from birth on, we would not be seeing the disease rates that we're seeing.
Yes, and speaking of prevention, so when people come to you and with a freshly, let's say, diagnosed cancer, what is about the timeline of between the it becomes beginning of a cancer, people should do start to do something, and the timeline where it's preventable, let's say, and diagnosed, I would should say.
So, cancer is, I tell people, prevention is priceless. And from one cancer cell in the perfect storm to a tumor is about 8 to 10 years. Now, if you're exposed to radiation like Chernobyl, you may get cancer in about 3 to 4 years. So that means we have so much opportunity to prevent cancer. And in my book, Cancer Revolution, and my upcoming book, Cancer Revolution Updated, I talk about and reiterate how we need to prevent cancer and or early detection. And so that's why we have so much time to prevent cancer, because it's not something that you just wake up one day with cancer, just like any disease. If you have Alzheimer's or heart disease, cancer, they're diseases over a chronic period of time. And so if we understand the Warburg principle, we understand the mitochondrial principle of cancer, we can prevent cancer. And in my book, I talk about this in detail. And because I had lots of mentors in my life who taught me what I know today. And then because there's constant research coming out, new things coming out, new ideas, new theories, we all need to be open to these new theories and really cooperate and collaborate to heal the patient.
But for most people, when they hear you have cancer, they're stunned. It's falling, the reality is falling upon them, even though, as you say, it has taken years to develop and to get them to the stage of the diagnosis. So, what can they do? What should we do long before any possible diagnosis, eventual diagnosis? What should we do to prevent cancer on a daily?
Prevents cancer. They did a study of 44,000 identical twins, and they said the greatest single determinant of whether they were going to get cancer was their diet, what they eat, and their lifestyle. And so everyone needs to really look in the mirror and look how they live every day. So, for example, when we see a patient, we always address their 24-hour life, because most 50% of the population doesn't sleep. So we assess their sleep, and are they sleeping? How much water and purification of water? Are they drinking water that, if you're drinking tap water, you're just drinking pharma water and toxic water? Then we assess what they're eating every single day. And then we assess their movement, because exercise alone reduces cancer 60%. And most people today are not moving. They said sitting's the new smoking. And then we address their mouth. We address, do they have mercury fillings? Do they have dental disease? Do they have root canals? Do they have any other thing going on in their mouth? Because the mouth is the gateway to the rest of their body. And then we address stress. And because stress, as we know, creates a multitude of problems and changing the physiology and the biochemical reactions that take place in our body. So that's the first thing people can do, is look and see, how do I live every day? How am I in disorder? And start working on it, because a lot of it you can just do yourself. If you like really assess and are honest with yourself, you can really assess, how am I living? How am I eating? All these things. Okay. Then if you can partner with a physician, a functional medicine doctor, who's going to combine the best of conventional with the most latest, greatest in integrative medicine or oncology. Okay. Because all doctors should be assessing a patient and saying, how do I prevent every disease, not just cancer, but all diseases? Instead, our medical system is, the doctor gets paid on how many diagnoses they have. So the more diagnoses, the better they can bill. And so we have to get away from that, because right now, 18.5% of the GDP is spent on healthcare, and they said by 2030, it's going to be much higher. So all of us together, doctors, public health, people like you, like me, we need to be openly talking about this and say, look, this has got to stop, because cancer and other chronic diseases are only escalating. So that means we're just not going to have a healthy nation. And so if we don't have a healthy nation and healthy people, we can't all function together. That's the bottom line. We're
Uh,
all interconnected and interconnected.
You just touched upon the things that we need to do to prevent cancer. What are the bad habits and the opposite things we need to get rid of to avoid cancer?
That's the purpose of the 2025 Beljanski Integrative Cancer Conference, a meeting of the world's top minds in complementary, alternative, natural, and integrative cancer solutions. The proceeds go towards funding cutting-edge cancer research, delving into a brand new area of science concerning cancer stem cells, which could hold the secret to ending cancer once and for all.
First of all, sleep. You need about 8 hours of sleep. Some people need 9 hours of sleep. Your day starts when you go to bed. And the magic of what happens when we sleep, it's repairing, regenerating, detoxifying. So we've got to make sure that we're sleeping. And like I said earlier, about 50% of the population has a sleep disorder. And we don't want to give medications because medications really cause central nervous system depression, respiratory depression. And so that's not a good answer for sleep disorders. A lot of people are on their screen with the blue light and stimulating their body and doing all these other things. Lights, the lights are not good for us for the most part. And all of that prevents you to creating a good night's sleep. So I tell people you've got to create a sleep sanctuary. Turn off the electricity to your bedroom. And if you need help sleep, try to find natural agents, valerian, 5-HTP. And there's all different things that are out there to help people sleep. And then people need to be aware of their water. You have in this day and time, you have to have some kind of water purification system because there are so many chemicals. You can go on environmental working group. You can see what chemicals and things are in the water. Heavy metals are in the water. Chemicals are in the water. Medications are in the water. So you've got to stop putting more toxins in our body. We already know that human beings have over 200 toxins in their body. They found it in blood and placenta and breast milk. And doing environmental pollutant panels, we see all of these chemicals and toxins. And so they've got to have water that is purified. Then people need to eat real food. They need to eat fruits and vegetables, good oils, olive oil, avocado, tallow, these kinds of butter, good fats, okay? And then people need protein. And so protein sources are protein powders, although real food like lamb and chicken and buffalo and grass-fed beef, all these kinds of proteins are, and if you eat some fat, some carbohydrates, and some protein, you prevent the insulin roller coaster that happens when you eat lots of sugar and carbohydrates.
Specifically, sugar, that's a big thing in the traditional, let's say, conventional American diet. Too much sugar and even high fructose corn syrup. What can one do to eliminate sugar?
Just stay away, use natural sugars, which are fruits and vegetables. Everything has carbohydrates, like protein even has carbohydrates, but stick to fruits and vegetables as opposed to cookies and donuts, all right? A lot of people in the morning, people eat cereal. Cereal's not really a good breakfast to eat, okay? They would be better off eating a fruit, eggs, and maybe a whole grain piece of toast, okay? And then for lunch, eat again like what I do for lunch because I eat a light lunch. I eat cottage cheese, which is a fermented food. And I usually put bee pollen or something from bees on it and then fruit. And a lot of times I'll have a little raw cheese because I want to be awake and alert. So that's the kind of lunch I'll have. And then at dinner time, like last night, for example, I ate scallops with squash blossoms and eating foods that are real and they're not processed fake foods and processed foods, okay? We need to eat foods that are found in nature as opposed to fabricated in some big food company that nothing is alive and nothing the food doesn't have energy.
Yeah, no, it just a package to survive longer on the shelf and bring more profit to the company.
Right.
Absolutely.
And
It's
then
not
if you
designed to be healthy. Yeah.
Yeah, and if you look at the ingredients, you have to go down the rabbit hole, Sylvie, with everything today. You've got to understand everything that is in these foods, the chemicals, the dyes, all the hydrogenated fats, etc. If people did a forensic analysis of their food, they would really avoid, like just recently, red dye was removed. Thank
Yeah,
goodness.
finally.
But there's many chemicals and toxins in food. And so not to mention the dyes and the hydrogenated fats, etc., and or the seed oils. So people just don't know. And so we've got to educate people and we got to educate physicians about the power of food. And then movement, I would say there's 800 muscles in the body, and our muscles they stimulate energy in your body. So the more you move, the more energy you're producing. Okay. But we are sitting down today. 100 years ago, people didn't have the mobilization of things that we do now. Now we have cars, and now we have computers, and we have all these things that are counterproductive to the functionality of our body. So we need to move. We need to take every opportunity to move. And before, everybody did everything by hand, whether they washed their clothes and they foraged for their meat and their produce and their fruits and vegetables, and they churned the butter and they milked the cow. They did things that everything required physical energy, and they were outside a lot of times and enjoying nature and the sunshine. And so now we're inside, everything's artificial, computers. So we have civilization is not helping people survive and thrive.
Yeah, absolutely. And there is a stress also that
There's what?
the stress, the mental health and stress that I'm sure as a holistic doctor, you are taking into account the stress level of your patients, especially when they hear the little sentence, you have cancer, that so brings the stress level to the roof. How do you tell your patients not to give up hope and give them the fortitude they need to carry on and sometimes include difficult changes to their life?
Hope is medicine, right? And the belief of something to be that can occur. And I always give my patients visualization techniques. So we are very big on addressing the stress and the unfavorable emotional conflicts in someone's life. And so I always ask the patient, what happened to you in the last 8 to 10 years? What went on? And patients, I would say almost all the time, they will tell you exactly what happened. Okay. And what contributed to the development of this cancer. And I always tell people cancer isn't just one thing, it's multitude of things. And so that's why if you're going to a conventional doctor, he or she is going to say, okay, your options are surgery, chemo, radiation, and immunotherapy. But we all know that does not work all the time. And also, we have to inform and educate the patient when you do a biopsy, when you do surgery, when we do chemo, when we do radiation, and we do immunotherapy, they all have injurious, inflammatory, immunosuppressive properties. So, as a physician and caretaker of my patient, we need to be protecting the patient every step of the way. And so if a patient needs a biopsy, what is the protective protocol? Surgery, what is the protective protocol, etc. So if a patient has high cholesterol, a lot of doctors give statins. I don't personally give statins to my patients. But if you're a conventional doctor and you're giving statins, you should be giving coenzyme Q10 and liver protection and probably brain protection because we know those are consequences of giving a statin. And then if you give an antibiotic, for example, and I had a patient the other day who had taken 100 dosages of antibiotics. What happens when you take antibiotics? Even after one time, you deplete your microbiome and you increase the possibility of growing yeast or fungus, which contribute to the storm of cancer. So you have to think everything. I always tell people every decision you make in your life is a healthcare decision. So you've got to look what you're doing. Is everything elevating you and advancing you to a higher level? And then the doctor you're partnering with, is he or she advancing you and making you better? If the doctor's not making you better, you need to find someone who's going to partner with you to make you better. Because any patient I have here, let's say cancer, because I treat everything, but if I have a patient with cancer, in the first week, almost all patients feel much better, okay? Even if they're stage 4 and very serious, okay? And in this day and time, Sylvie, we can't rely on the conventional paradigm for treating cancer because we live in a very different world, and we know the tumor microenvironment. We know you talked about stress. We talked about toxins. We talked about bugs. All these things contribute to the demise of the cell and the energy of the cell. So just addressing and killing the cancer is not going to work because you have to develop all these healing pathways. Yes, sometimes a patient can have a simple lumpectomy in their breast and maybe survive for 10, 20, 30 years and the cancer never come back. Okay. Yes, there are those cases. All right. But for example, I see many patients. I was diagnosed in 2018. I was diagnosed in 2019 and their cancer is back. Why is it back? Because you didn't change the terrain and the garden that the cancer came in.
Absolutely. People don't get rid of the cause. The same thing comes back again and again. Absolutely. Absolutely. You have a book coming up, right?
Yes. So I wrote Cancer Revolution in 2017, and now my book will be coming out this year. And hopefully, when we do the Beljanski big talk in April in Austin that you are organizing, I will be announcing pre-sales of Cancer Revolution Updated. And because as things are constantly evolving, and I'm always adding new techniques, new things here in the clinic, when I read something new or I find something that can help the patient heal, I'm always looking forward to new things because what's out there now is it's just not enough. So we have to use these new updated medical revelations that are available to everyone, whether they are on PubMed or they go to lectures. And the problem is a textbook is outdated and we're 20 years. I talked to a new lady doctor today. She is in residency and she grew up on naturopathy. And she's, oh, I just see the failure of medicine. And I really don't want to practice just the conventional medicine. I told her it's very important that she went through her training like she did because she understands very serious things and she knows how to treat when you have an emergency or a very serious medical problem because you need to know how to do that. But the treatment of patients needs to be aligned with all the things that we know, whether it's restoring the microbiome, restoring a patient's hormones, their nutrient levels, getting rid of the viruses, bacteria, fungi, and parasites, et cetera, et cetera. And I was just so excited that we have a young person. And there are more and more young people because we rotate a lot of students, Sylvie, here. And so it's great that these young people are interested in a new way of treating patients. And it's not really new, but I just call it's whatever works medicine, right? And updated medicine. So it's exciting.
So you said you have a lot of people here. Where is here? Can you tell everybody?
Yes. So we're in Orange County. There's 33 counties in Orange County, and we're in Irvine, which is in the center of Orange County. So that's about an hour north or south of Los Angeles. And then San Diego's about an hour and 15 minutes south of us. So
Okay.
people fly in from all over the world, and I get a lot of referrals from physicians or naturopaths or other kinds of practitioners, or people read my book. Even the Cancer Revolution has lots of powerful information for patients to take charge. I've had patients just read my book and implement a lot of that and treat themselves. We have a student here from New Jersey. She graduates, I think, in June, and she herself got diagnosed with thyroid cancer. And she read my book and changed her life. And that's why she's here doing a rotation. So cancer is being diagnosed earlier and earlier. And it's getting their attention, and I believe our young people are going to transform the future of healthcare and humanity.
Yeah, sure. Going to take over the world.
Yes.
The new generation that's coming up. Absolutely.
Yeah. So
I'm really excited and looking forward to having you at the Beljanski Integrative Cancer Conference in Austin, Texas, April 25, 27. It's going to be a great weekend. We have the best speakers knowledgeable about cancer in the world of integrative medicine. I know you will be especially honored and recognized, and you fully deserve it. And you, with this wonderful clinic that you have been running now for many years, which is quite a great achievement by itself. But what you are bringing to the to s- to the cancer, when people suffering with cancer, and there are more and more of them, it's really a blueprint for a healthy life, and we all desperately need that, even if we are not touched by cancer.
our goal, I always say that our number one value needs to be health, because everything you do, whether it's with your family or having a family or working or your passions, they all hinge upon having a healthy system. And our people that come here for prevention, all of them, I would say, do not have homo interruptus, which means a life interrupted. And so, because they do the things they need to do that we find, and then they learn themselves how to take care of themselves. Because I say that self-care is the new healthcare. And so people, though, think that they feel well, Sylvie. They think, oh, I feel great, no problem. I had a patient yesterday, she had breast cancer in 2018, but she's got a big lump on her neck. And she says, Dr. Kinley, I feel great. So she goes, it's hard to think that I have cancer. And I hear that frequently. Like people said, I feel great the day before I had cancer. So your body is constantly trying to take care of you and get you back into homeostasis. It's so powerful. And so that's why people don't feel anything, because your body is in this constant repair, regenerate mode and taking care of you. And I see how powerful it is when patients have significant disease and they feel okay, like they have stage 4 cancer and they actually feel okay. So I always tell people you can't manage something you don't measure. So we need to teach people how to take care of their health, then get a routine checkup with the proper routine, and then say, okay, I'm good and I'm getting better, and see them in a year. Really, that's the way it should be. But we're all in the medicine's in the business of disease and sick care, as opposed to preventing and optimizing. We're not in there. Now, is it changing? Yes, but little by little, because the doctor today trained, she or he doesn't know about integrative functional medicine unless they personally seek it out themselves. And then if you go to medical school and you do training, you're busy the whole time. You don't have time. You don't have time to learn unless you just have a moment here, there, and yonder. But And learning integrative functional medicine is like a whole nother world in and of itself. Just understanding nutrition, just understanding like the targeted nutrients like the Oncobel Pro or vitamin C or vitamin D, understanding the necessary utilization of these things in a medical practice is very scientific. It's not, oh, this is a great idea. No, this is scientific. And so doctors just haven't learned that language and haven't learned that evidence-based medicine. So,
Well, thank you for sharing your knowledge, and we look forward to having you and recognize you at the Beljanski Integrative Cancer Conference. This is going to be a huge moment, and we thank you for gracing us with
well, thank you.
your presence.
Oh, thank you, Sylvie. I appreciate it.
Is there any other topic you would like to address and cover?
I think we should cover the aspect of like when you get a diagnosis, don't panic. And really try to get as many opinions with the conventional doctors and an integrative oncologist, because you need to look at all the paths of healing. And you brought up stress and emotion. And if you look at the work of Bruce Lipton, The Biology of Belief, and then there's another lady who just wrote a book, I don't know her name, but she wrote a book called Dying to Be Me, and she had 2 weeks to live. And she had a near-death experience and really realized her purpose in life. And she came out of it and is alive. And if people could understand their thoughts, feelings, and beliefs about themselves, a lot of people, I don't feel, love themselves. They don't just think they deserve to be healed. I think they don't think they can be healed. And then most people don't truly understand their condition. So I always tell people you can't change your condition unless you understand your condition. And read as many books as possible, all right, that marry the conventional with the integrative functional medicine, especially oncology. Oncology is a whole nother world. So the typical functional doctor doesn't do oncology. So make sure it's someone who does oncology every single day, understands the drugs and what they do, and how to marry the conventional with the functional and integrative, and knows how to use repurposed drugs and the IVs and et cetera, et cetera. And so I think, like you said, the first thing when someone's diagnosed is immediately panic and fear. And I don't know what to do, and they're paralyzed. Instead, look at it as an opportunity to explore all possibilities and learn everything that contributed to the cancer, because trust me, on PubMed, there is a voluminous amounts of information. I tell people there's 1.2 million PubMed articles per year. No doctor, no institution is keeping up with the amount of information available to a patient. And talk to other patients who've healed themselves with other modalities other than just their surgery, chemo, and radiation and immunotherapy. And so look at all the things they do. And I know lots of people are talking about their journey and sharing all the things that they do. And in this day and time, you have to live differently. If you're 30 years old, I used to say there was a warranty until you're 40. Now I can't say that, because 20-year-olds are here with cancer and young people.
Younger and younger, that's terrible.
Right. Yeah. And don't make quick decisions. Make educated, informed decisions. Because a lot of times I hear, oh, I should have been here in the beginning. Oh, I didn't know what I know now, because your disease did not just happen in the last 24 hours. It happened over the last 8 to 10 years. So unraveling a disease is not just going to be doing surgery, chemo, and radiation, because if you do those, you can create the growth of cancer, actually, because there's chemo resistance, there's radiation resistance, there is complications from surgeries, there's all kinds of things. So that's why you've got to look at all the ways of taking care of yourself and restoring health as you go through. a cancer treatment, because just like getting chemotherapy alone, all right, chemotherapy damage every cell in the body. And so that means you have to be regenerating every cell, whether it's an immune cell, a liver cell, a heart cell, a kidney cell, brain cell, it doesn't matter. We need to be caring and keeping ahead of the treatment because the treatment is so damaging.
Thank you. Thank you very much. That was
You're welcome.